pregnancy and how to diagnose this. We can start with many pictures from the pregnant woman, like chloasmas that represent pigmentation of the skin of the face. Here we have an increased in size image or zoom in. Also we have two pictures of stria around the umbilicus that are characteristic for a pregnant woman. Also we can see some stria to patient with Cushing disease. We have to differentiate if we do not have a positive test or other symptoms, clinical manifestations. So here we have a presumptive, probable and positive diagnosis, but I can classify it like clinical manifestations, like laboratory assessment and ultrasonography confirmation. So presumptive test represent amenorrhea. It's the first thing that women feel and can count, like from the last menstruation and the duration, knowing the duration of the normal menstrual cycle. Breast tenderness, nausea and vomiting from increased beta-ACG, increased pigmentation of the skin, of the face, of the abdomen, skin stria. We have seen these images like chloasma and umbilical stria or skin stria around the umbilicus. A probable test will be enlargement of the uterus, sensation of uterine contractions, sensation of fetus movements, but a beta-ACG test, if this is positive, it's like a 100% that woman is pregnant, and it can be done only after 10 days of the ovulation, because only at that time it can be positive, or after 10 days of unprotected sex. It will be certain, like 10 days after unprotected sex and a possible pregnancy. A positive diagnosis can be made by assessing of fetal heart tones by auscultation, or ultrasonography is definitely the test that can confirm this by visualizing the fetus, the fetal movement, the fetal position in the uterus, also heart rate and possible malformations even of the fetus, and even a fetal lung movement at the last trimester of the pregnancy. Perception of fetal movement by the examiner. It can be done by Leopold maneuvers. It assesses the position and movements of the fetus, and on X-ray fetal skeleton, but it is done very rarely or incidentally because of known harm effect of the X-rays. So once again, we can do a clinical assessment and manifestations. We can do some laboratory tests, that is beta-HCG done mostly, and confirmation with ultrasonography. Thank you for your watching. Hope this video is useful for you, and see you.